So during your surgical consultation here at ReVision, the doctor that you meet with will spend a lot of time with you. This is a big decision, and it's your vision for the rest of your life. So we really want to get to know you, your hobbies, what your visual goals are, and what your expectations are. We then try to match the best procedure and best technology to you, to your expectations, and to your eyes. So prior to having vision correction surgery, we feel that patient education is of paramount importance. You'll be educated by your doctor in the consultation. You will then meet with a patient educator who will review a lot of the things that you heard from the doctor. All staff is knowledgeable and trained, so if you have any questions along the way, they're there to answer basic questions. And then again, on the day of the procedure, your surgeon will answer any lingering questions or concerns and walk you through the procedure until you feel comfortable proceeding. Prior to having vision correction surgery, the most important thing for a patient to do is ask all of the questions that they have. We're here to educate you. We're here to answer those questions so you feel good about proceeding with the procedure. And of course, just relax. You're in good hands here at ReVision. We have all the best technology to ensure a great result. I think it's known that ReVision is a high-tech center. We've heavily invested in our surgical equipment and have the state-of-the-art equipment to ensure a safe procedure that's quick with outstanding results. But you may not know that we have extensive technology in our exam rooms as well, in our clinic. And the reason for that is pre-operative or pre-surgical planning is so important. You need the best, highest quality data to then input and calculate to ensure a great surgical result.
So with any surgical procedure, there's healing periods. And those healing periods vary from patient to patient and eye to eye. You know, I tell patients, remind them frequently that we are not working with pieces of plastic. This is human tissue. This is healing. This is biology. Now, the typical patients, they breeze right through these procedures, but some patients have a little more healing time, a little more dryness, a little more swelling, may need some additional medications or enhancement procedures, and that's part of the process. Not for the majority of people, but for some. And we're here to make sure and reassure and explain and educate each step of the way through the process. So seeing us at ReVision, you don't need a referral to come to us. However, we work with a lot of eye doctors in the community who refer their patients to us and participate in the care, either preoperatively or postoperatively. And so your doctor may refer you here, and then once your surgical procedure is over, you may go back to your local eye care doctor and have your follow-up visits. We do this, it's called co-management. We do it all the time, and it's in the best interest of the patient.
Here at ReVision, we consider our referring optometrist as an extension of our own practice. It's really important to us that we keep all the lines of communication open. We listen to what they say about you and your eyes and your visual goals in their exam notes. We review that with the patient, and then communicate back to them what procedure we recommended and why. And so communication really is key. So here at ReVision, we have everything in-house. It'll be the same team, the same treatment, the same facility for your preoperative evaluation, your surgery, and your postoperative care before you return to your ophthalmologist. That's a pretty uncommon model. A lot of centers will have an evaluation in one place, a third-party surgery center, different staff. There's not as much continuity, so having everything in-house, we know, and from experience, makes patients more comfortable. They see familiar faces, they only have to go to one building. It really minimizes the stress of what is a very stressful situation for some, and the more that we can comfort you, the better your experience is going to be. So that's why we have it all in-house here at ReVision.
Here at ReVision, we pride ourselves in the culture that we've created, and we work hard on our culture. And it's simply treating individual patients the way we want to be treated. And so when you come here, I hope your experience is you feel that culture. And this is a place where life-changing procedures happen. And we take that very, very seriously. So from your pre-op evaluation to your surgical procedure and the education that takes place ahead of that, to your post-operative care, We are an all-encompassing organization. We can handle your pre-op, your education, your surgery, and your post-op. And we pride ourselves in providing those services to our patients.